Senator from Louisiana.
Yeah, thank you, sir. Mr. President, COVID-19 is a continuing threat to Americans' physical and financial health. And it's at this intersection that Congress can make a meaningful impact on the family budgets of all Americans by passing sensible legislation to lower the cost of prescription drugs. Legislation such as the Prescription Drug Pricing Reduction Act, or as I like to call it, Making Coronavirus Medications Affordable Act. Now, there is an urgent need to lower the cost of prescription drugs. The high price of drugs is not a new problem, but it's a problem that's going to be made worse by the coronavirus pandemic. Millions of households have seen their income suffer due to economic lockdowns aimed at containing the virus. Now, I'm encouraged that the jobs numbers continue to outpace expectations, but still, a lot of millions of fellow Americans are out of work, which affects their pocketbook and potentially their insurance coverage. Americans do not need the added burden of expensive drugs, particularly right now. Congress has provided relief for American families and businesses through the COVID-19 crisis, and we're considering another round of support. I think we should include how do we make drugs more affordable. That way, if folks become ill, they know that they will be able to afford the cure. And I believe the best path forward is the Making Coronavirus Drugs Affordable Act, as I call it, or as Chairman Grassley calls it, the Prescription Drug Pricing Reduction Act. Again, I like mine better. Now, the difficulty in addressing the issue of the price of medications, Mr. President, you have to strike a balance between making sure the medication is affordable, but making sure there is still a profit motive that will incentivize the researchers and the pharmaceutical companies to find these cures that we know that we need. Just think about it. Without innovation, we would not be able to find a vaccine for coronavirus, a vaccine that will save millions of lives worldwide and allow us to go back to a normal life. And let me just praise the pharmaceutical industry. We've seen them respond to this crisis in many helpful ways. Additionally, they've recently committed $1 billion to antimicrobial resistance, which is to say, to find an antibiotic that will work when other antibiotics no longer do. They've invested in rapid and large-scale vaccine and treatment options, and again, it's only through this innovation that we will beat this virus and end the pandemic. But we must remember this. If a patient cannot afford the innovation, the new medicine, it is as if the innovation never occurred. The Making Coronavirus Drugs Affordable Act strikes the balance between lowering costs for families and incentivizing companies to find those cures. Let me show you what this bill does. It caps the patient's out-of-pocket expenses. It lets patients pay over time. It protects patients from price gouging, and it preserves the incentive for companies to find cures. Let me explain each of these. First, the bill caps the out-of-pocket expense for those in the Medicare Part D program, which are those who are senior citizens, and particularly for the most vulnerable seniors with chronic conditions. Go ahead and show me the first one. Research has shown that seniors are at the most risk for severe complications and death from COVID-19, and when a treatment or cure is widely available, cost should never be a barrier for a senior to access the drug that she or he needs to survive. Now, under the current system, Mr. President, this is what a senior citizen pays for their medical benefit under Medicare Part D. They have a deductible for which the senior pays 100%, the initial coverage phase and the coverage gap phase of which they pay 1/4 of the expense, and then in the catastrophic phase, the patient pays 5% of their cost no matter how high that expense goes. So let's just imagine a medication which costs over $1 million. They're paying 5% of that medication cost, and if I could stand up any higher, but I keep on losing my microphone, they would pay 5% of that. Let's think of a theoretical drug that costs $3 million a year. The senior would be required to pay 5% of whatever that drug cost. That's under current law. What we're trying to do is fix this. If this occurs, the senior will not be able to afford life-saving medications. Can we have the next one, please? Under the legislation that we're attempting to pass, we changed the Medicare Part D standard benefit design so that there's still the initial deductible in which the senior pays 100%. But after paying 20% of the initial coverage phase, there's no longer that 5% towards infinity. We make medications affordable for the senior. And if that's all the bill did, we would do something quite remarkable for the ability of a patient to be able to afford a potentially life-saving drug. And by the way, I'm a physician, Mr. President. I know this is a barrier for patients to be able to have their drugs. And so we address that in this bill. Now, the second thing we do, you might say, wait a second. The senior citizen, if she or he has to pay this all, say a very expensive drug, in the month of January, they can't afford that. Under the current situation, the senior has to pay her deductible and her initial coverage phase whenever it's due, which might be in the first week of the year. What we also do in this bill is we give the senior citizen the opportunity to pay all this lump sum as a series of payments over 12 months. So let's imagine that this is $10,000. Instead of having to pay it all in January, she could pay $800 every month over the course of the year. That allows her to budget and to factor it in with the other sources of income that she has. So not only do we cap the senior citizen's out-of-pocket expense, but we also allow her to pay that expense over a set of months so that she can factor it into her budget. That, Mr. President, is a second great thing that this bill does. What is another thing that we do? Senator Braun already referred to this. You can take that down. But we also have cost transparency. If there is a medication which has the price being elevated unnecessarily, and if the customer knew that, she would know, wait a second, I can get my medications far less expensively here versus there, or if I accept a substitute, again, the medication will be more affordable. We mandate that kind of price transparency that allows the customer to make an informed decision. Now, I know that there are competing ideas on how to lower drug costs. House Democrats, for example, have introduced legislation that they claim would lower cost. But remember, Mr. President, I told you that there's this tension. How do we preserve the incentive to innovate while still making sure the innovation is affordable? House Democrats have put up a bill. Yes, it makes medicine more affordable, but it kills the desire to innovate. The Congressional Budget Office has estimated that if the bill that House Democrats have proposed is passed, there will be 38 fewer cures, Mr. President, invented by pharmaceutical manufacturers. 38 fewer cures. Let me tell you a story, Mr. President. I mentioned I'm a physician. I came in my residency of age, if you will, when the AIDS epidemic hit. I was 25 years old, 27 years old. And I would see men my age dying of HIV. And we didn't even have an antibody test then. But if you were diagnosed with HIV, or we called it AIDS then, you basically were dead because we had no cures. Since then, we now have medications that if you're infected with HIV, you can live until you're 75 years old, 80 years old. We have found something which doesn't quite cure, but it allows it to be treated as a chronic condition. Now, what if we didn't have that cure, Mr. President? What if that was one of the 38 cures we never had? Mr. President, what if one of the cures we lose out on is a cure for Alzheimer's? My parents died of Alzheimer's. All of us know somebody affected by Alzheimer's or dementia. What if the cure we lose is the cure for Alzheimer's? Mr. President, you may think you're making medications more expensive, but in terms of human life, you've made it that much more expensive. Because instead of finding that cure for Alzheimer's, you instead consign those people with Alzheimer's to a slow, awful death. Awful for them, awful for their loved ones as they see their parent decline. So, Mr. President, I would argue that it is fool's gold to say that the House Democrat bill saves money. It just shifts it, and it shifts it to the misery of the family that will never enjoy one of these cures that is not otherwise developed. So to fix the problem of the high cost of drugs, it will take a bipartisan coalition. We have this bill. It ends government hands-out to pharmaceutical companies, but it doesn't price fix. It saves $80 billion for the taxpayer and for the patient, and it maintains incentives for life-saving innovations. Some in this chamber will be tempted to stop this bill until after this year's election. To them, I would say, don't let politics keep us from delivering drug pricing relief for American families. Too much is on the line, especially during this pandemic. To do nothing while families try to pay medical bills is wrong. Let's work together to pass this bill to lower the cost of drugs, to protect innovation, and to save lives. Thank you, Mr. President, and I yield the floor.